so many questions. We should do this.
Check, 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 check. Mic check, check, check. Check, 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 check. Check, check, check.
That, I think the Giovanni's thing is a good question. Like,
Giovanni's is a one thing, but then you have to ask them about the weekend, what they're going to do going forward after. Because it didn't even sound like Martell was entirely the state's, disposition at restaurants and bars were.
This is like the whole unfairness thing. Now I'm starting to like really sympathize with some of these bar and restaurant owners that are complying, because I'm like, yeah, you're right. Why should you comply?
Yeah.
Nothing happens to anyone else that's not complying.
Exactly. And that goes back to, well, what can the governor really do?
You know how they talk about, like, she talks about these one-time events, large events that are like problematic, and how difficult it is to like do anything about them. But I guess I would like to ask, why is that? Why can't you? I mean, you know that they're coming.
In particular,
that one
we knew. We knew about that one well ahead of time, and they had a Facebook feed. Well, the Facebook feed was very cropped to only have like the very front of the room.
Yeah.
But I mean, that was Alexis Caracol and I were out there. And we were just like, there were so many people in that room.
Yeah.
So many. Yeah, you were out there.
Yeah.
But you were in and out, I think, for your 6 o'clock hit when you bounced, right?
Yeah, after 6 o'clock. Because I knew that they said no media.
Yeah. Yeah, I had to wait out there for like an hour and a half, 2 hours for Severson to come out.
Oh God.
It was a great time. Really built some character. And maybe a small case of hypothesis. Yeah, not a great day.
Yeah, because it was a whole thing. It was like dinner.
That line was on.
Yeah.
I don't know if it was a dinner. I know that like they were trying to like spread people out throughout
Through the different rooms, yeah. That's what they told me.
But like even then, like people were coming out and telling me that like it's standing room only in half these things. I'm just like, COVID.
But like, why wasn't there enforcement then of that event? I mean, like, we're not the only ones who knew that there were hundreds of people there. They could have very easily sent someone over.
Yeah. I don't disagree with you.
Good afternoon. I'm Dr. Sandra Martell, Public Health Administrator for Winnebago County. First of all, normally I'm joined by the Mayor of the City of Rockford, but I know I join the entire city in our condolences to his family on the loss of his father. So today, though, I'm going to give you the update. From last week, we learned a lot about what was going on in our region and understanding some of the things that we're going to have to do a little bit differently. But today as well, we heard from the CDC, who provided an update on the transmission of coronavirus and what they understand, and really presented kind of more of a framework or a hierarchy of how things happen, kind of a continuum, if you will. We all know from everything we've said before that COVID spreads easily from person to person. I don't think that's a new concept for anyone here. It spreads more easily than influenza, but not as easily as measles. So we've learned something throughout this pandemic. And it most commonly spreads through close contact. Respiratory droplets, being physically near someone within 6 feet. And we found out as time has gone on that the concentration of virus decreases with distance. So this becomes very important as we talk about some of the mitigation strategies that we're talking about. Why is 6 feet so important? Why is it that, when you look at diagrams and things of where people sit in a particular area, the further away you are, the less likelihood you are to spread or to be infected. It's sometimes spread by that airborne transmission that we heard about, which is much smaller droplets. That's similar to what transmits TB, chickenpox, and measles. And that can be spread at greater distances than 6 feet. So we're learning more about this virus, more commonly spread through close contact of respiratory droplet, less commonly by airborne transmission, but still can be transmitted. And it's least likely to be spread through contaminated surfaces, which really means that while we have been encouraging everyone to clean surfaces frequently, we shouldn't stop that practice. The likelihood of a transmission is less with that. We've learned that it rarely spreads between people and animals. We had a lot of concerns initially about people and their household pets, and the concerns about that. And we also don't see it in reverse. So we don't see pets spreading it to humans. But this becomes really the explanation about why we're so concerned about transmission in indoor spaces and environments. The reason that we've seen is removing a face covering for eating and drinking is a common behavior that we've identified in our contact investigations. Typically, why? You're sitting closer than 6 feet across a table at someone as you're eating. You're removing your face coverings to eat and drink. You're oftentimes talking, you're cheering, you're laughing, you might be telling a story, you might be debating politics, you might be cheering on a sports team. These are all things that increase the number of droplets. And we also know that alcohol lowers inhibition, so people tend to raise their voices a little bit more, get a little more animated, talk a little bit more. Some people may actually sing with you at a table. So this becomes part of the concerns that we have and why transmission is so important for us to understand, because those are the actions we need to take. We also learned on Friday, and as we get for implementation, that we went into what we call Region 1, went into Tier 1 mitigation. We had experienced 6 days of positivity increases. We had 4 days of hospital admissions increasing with COVID-like illnesses. So the argument I've often heard is there's plenty of room in the hospitals, that's not a big deal. Our hospitals are monitoring themselves very closely. They're considering additional visitor restrictions. They've had to consider whether or not they take transfers from other local community hospitals. And again, they're also faced with some of the concerns. There still is supply shortages throughout the supply chain. There has been kind of some discussion about shortages of gloves and shortages of N95 masks. There's also, as we've said before, while there may be a bed, staffing considerations have to be taken in. So some of the things that we have to kind of take a look at as we move through that, we were seeing that 6 day positivity increases. We had a rolling positivity rate of our Region 1 at 8.7%. Well, we were well above the 8%. Our positivity rate for Winnebago County was at 10.4%. So when you think about 10.4%, and I'm in that restaurant scenario or sitting at a dining table, 1 out of 10 of us had the likelihood of being infected. And not intentionally spreading it to anyone, but we take our face coverings off, we start talking about what's going on. We may sit for a couple of hours, so that time duration increases, which is why this disease is spreading so quickly in some of these venues. So what is the research and mitigation? What things get applied to us? Well, we learned there were no indoor services for bars and restaurants, outdoor only. So this is challenging at this time of year for everyone. But it's the tents, they have 2 sides must be up, they can put heaters out there, but outdoor only. Bar patrons, even when you're outside, you have to be seated at tables. Why? Because we stand shoulder to shoulder, we're not 6 feet apart, we tend to have our face coverings off when we're drinking because that's how we drink, and that increases the risk. Reservations, when you come into a bar or restaurant, they're going to take your name, even though it's outdoor. They're going to take your name so that if there is an exposure, that you can be quickly contacted should there be one, so we can do contact tracing. They're not going to allow you to seat multiple parties at one table. So if you're coming in as a couple, you'll sit at your table. You won't be seated with anyone else. And the idea being, again, we know that people tend to let their guard down when we're in those scenarios because we normally take our face covering off to eat and drink. And social gatherings are now limited to lesser of 25 guests or 25% of overall room capacity, whichever is less. I've heard the wedding parties, you know, before it was 4 times 50 in 4 different rooms. It is not 4 times 25. And the reason for that is because of the duration of that time and the intermingling. Again, you've got typically household members are mixing throughout that. You've got people coming from different areas. No party buses. That would seem to go without saying. Because again, a bus is an enclosed space where a droplet infection, and if you're drinking in a party bus, the chance that you're going to then be moving around in that very enclosed space increases. Gaming and casinos close at 11 o'clock, and again, they're limited to 25% capacity, and they must follow all mitigations for bars and restaurants. And I want to be clear, though, that this does not apply to schools or places of worship. We have asked our churches and our places of worship to adhere to additional guidelines. So events and things that they plan outside the worship service. So Bible study groups, youth groups, things like that, we're asking them to keep the capacity, fellowships, same. Because again, the idea being that we are all in this community mitigation together. So how do we get out of this? I said it's kind of like gaining 10 pounds. It's really easy to gain 10 pounds, much harder to lose 10 pounds for those of us who struggle with that. If our positivity rate averages less than or equal to 6.5% over a 3-day period, then they can begin to lift some of those mitigation. But when you're at 10%, that's a hard way to go. So it's going to require a lot more effort. The flip side, if there's no improvement and our positivity rate continues to climb or remains stable at this high rate, additional mitigation measures may be put into place. And I've been asked what those might look like. Those might reduce even further some of the capacity limits. That may also say that there is no even outdoor dining at tables. This may be curbside pickup only. But again, those mitigations are applied to us through the Illinois Department of Public Health and through the Governor's Office and the Department of Commerce and Economic Opportunity. So we've been talking about this for about 4 weeks now, about watching those rates rise and that positivity rate. And I've been asked, why do we look at positivity rates? Because it's just not the number of positive tests. It's out of all tests submitted. And I'm guessing now that most of us know several people in our circles that have been infected. And if I were to have asked you 3 months ago, do you know anyone who's infected? You may not have. But now you may know it in your workplaces. It might be in a school environment. It might be in your social circles. It's obviously 1 out of 10. So if you were to look around, 1 out of 10. So how did our enforcement go, recognizing that this went into effect Saturday? So remember, we're complaint-based. So we have our policies and procedures up on site. So complaints were received on the following establishments: Baking Grounds in McChesney Park, Casey's Pub in Loves Park, City Buffet in Rockford, Filling Station in Rockford, Fozzie's in Rockford, Francesco's in Rockford, Fear Fest in South Beloit, Giovanni's in Rockford, the Golden Corral in Loves Park, Green Fire in Rockford, Irish Rose in Rockford, Jessica's Family Restaurant in Roscoe, JJ Deli in Rockford, Lima Mar in Rockford, Mark's Fusion Cafe in Rockford, Mustang's Bar and Grill in South Beloit, My Place Bar and Grill in Rockford, Neighbors Bar and Grill in Loves Park, North Main Bar in Rockford, Nora's Bar and Grill in South Beloit, Omakase in Rockford, Ref's Bar and Grill in Durand, Scanlon's Bar and Grill in Rockford, Savoy Lounge in Rockford, Sophia's in Roscoe, The Detour in Loves Park, Tony's of Winnebago in Winnebago, Town Hall in Loves Park, Taco Betty's in Rockford, Vintage 501 in Rockford. And while that list seems very extensive and very long, there are over 1,300 permitted establishments in Winnebago County. So I applaud the group that has really worked hard. And I actually have a correction. They were kind of signaling to me 1,500 permitted establishments. So when you come down to it, the majority did what they needed to do. So today the inspectors are out working on the complaints. Remember, we adapted and changed our policy with our food groups and said first visit, we're going to review the executive order and validate the complaint. Remember, some of them may have had outdoor dining. Someone may have again pulled it on there. If the complaint's validated, we will do a second visit for a notice of noncompliance. A third visit will be notice to disperse. And basically that means that we will then look at revocation of the food establishment permit, liquor licenses, and gaming licenses. And it may progress to a closure order. I really want to remind everyone this is an equity consideration and concern for our community. We have many establishments that followed the executive order, recognizing the difficulty that that was going to pose for them, but understanding that they were part of a larger community and need to help us get that infection rate low. Groups that continue to have those large gatherings, shoulder to shoulder, person to person, face coverings off, you're contributing to an overall increased infection in the community. And you're right, I won't be able to identify one particular establishment, but I know the behavior that's common to all. Businesses that remain open, I want you to consider what that means to both our lives and our livelihood. Businesses that comply with the executive order have been put at a disadvantage. They lost revenue, they lost business over the weekend. Many of them had very little time to plan for product and changes, and many of their staffs were impacted as well. But I'm also going to call again, as I've said before, we all have an equal part to play. The public has to do their part. You have to understand and know the restrictions set by the executive rule. So don't go into a restaurant expecting to be seated indoors. You should be seated out of doors. Support food establishment bars that are doing the right thing. Dine outside. Take carry-out or curbside pickup. Buy gift cards from them. Keep them in business because they are doing everything they can to protect our public. And of course, practice your social mitigation strategies. Wear your face coverings when outside and with individuals who are not in your household. And while we can't go into everyone's personal social gathering, I know this is a hard concept to understand. If I'm invited to a home, and I don't normally reside in that home, and I don't normally eat with them, or spend a lot of time with them, our gathering size may be well under 25, but that poses a risk because I am not part of that cohort, and I should be wearing my face covering when I'm inside that space. And I know that seems odd, right? We're so used to not having to do that. We're used to trusting our environments and going into someone's house. It's oftentimes maybe a sign we'd be concerned that that's not being welcoming or poor manners. But in order to protect each other, we need to be thinking about that. That may mean 6 feet apart. It may mean eating at a dining table where we are at one end or the other so that we can stay as far apart as possible. Stay home if you are sick. Please don't rationalize that the headache that you have, the sore throat that you have, the runny nose that suddenly came on, the body aches and chills. Do not rationalize that those are normal. Consider that that may be an early sign of COVID and take yourself out of an environment where you're potentially exposing others. Nobody intentionally does it, but we've got to be intentional about staying home and staying out of the public when we have signs and symptoms of illness. Maintain 6 feet of social distancing. I saw the pictures on your Facebooks from many of the establishments that got reported in, and I could see that there was no attempt to maintain 6 feet of social distancing. Again, we all have to do our part. And again, I remind our community, we have testing available to us. Get tested if you have symptoms, been in contact with someone with COVID-19, or been in a group setting with individuals who are not wearing face covering and social distancing could not be maintained. And I come back to our community understood the importance of testing. We have adequate testing. Right now, when we look at that, we are averaging over 1,300 tests per day. That's about just under 0.5% of the population is being tested. We are reporting new cases of 203 from Saturday through Monday. Our total positives now is at 6,685. And over 34% of our population has been tested to date. No additional deaths to report, but our 7-day positivity rate is 10.5%. And I know that our IDPH website for October 2nd is showing us at 10. So clearly we've got some more work to do. 4 new locations of concern we're adding: Alden Park, Strathmore, Alpine Fireside Health Center, Heritage Woods of Rockford, and Van Meter. So again, we come back, we keep telling us there's not a whole lot more mitigation that can be done. We want to be able to really maintain our business community, maintain our schools, maintain our places of worship, maintain our family structures and our lives and our livelihood. It requires all of us to do the right thing. We cannot enforce our way out of this, but we really need to understand that if we do not get this positivity rate as we approach the winter months, this could be a very long period of time in which we will not be able to enjoy some of the benefits that we got as we moved through the tiered mitigation, as we came into phase 4. This will impact larger and larger groups of businesses if we do not assist in this area. We will contribute to ongoing unemployment and increasing unemployment. Our schools may not be able to offer in-person alternatives. Our healthcare systems may not be able to serve or do elective procedures and surgery for us. We may not be able to visit our loved ones in skilled facilities. I remind us again, we can do this. Wearing a mask is inconvenient. Maintaining social distancing, sometimes hard to remember when we're used to being able to kind of say hello, hug someone that we care about. Washing our hands, staying home when we're sick. These are things we can do easily, and we need to do it, and we need to get serious about doing it if we're intentional about getting that infection rate and our positivity rate lower. So I'll take any questions.
Have we seen an increase in testing the past week or two?
It has been fairly stable over the last 5 to 7 days at about 1,300 tests per day. Actually, 1,314 was the average.
I just a quick note. I know you mentioned this at the last press conference, but some people are talking about going to get testing just for the sake of bringing the positivity rate down. I know you've talked about the things that are associated with the drug bacterial testing. I know one was that you must quarantine until your test comes back, but the second is, if I remember, it's if you have 2 negative tests within a certain time period, it's thrown out, correct?
Okay, I'm going to repeat the question, and that was a complicated one. So
Yes,
last week the question was, one of the things was, the question was, can we drive down our positivity rate simply by doing more testing? That's only if you're negative for the test. And the question was, do you have to quarantine while you're waiting your test results? And the answer is absolutely, you must quarantine. So the idea that you're just going through a drive-through 4 times in a week, you're quarantined during all of that time period. So that impacts if you have an employment, if you're working, that has an issue whether you can return to school. Then the follow-up question you had was 2 negative tests. We rule out duplicates within a week.
Okay.
Right, so
if you turn in 3 negative tests within a week, they all get thrown out.
Correct. We move those out of when I say the results are not thrown out.
Okay, yeah.
Let's be clear. The question was, if you test multiple times in a week, does something get tossed out? First of all, you're ruled out. We put basically in the count, we move the number out, right? So we don't count you 3 times if you tested 3 times in 1 week. But we do follow up with you on your test results. I want to be clear that no test results are destroyed or any of that. We will call you. But if you are a duplicate, triplicate, quadruplicate tester with us in a week period, we can detect that, and we will remove that number out of our total count.
Just one other thing that's really important for us to know, you mentioned the potential for additional mitigation strategies. Do you know how long Region 1's been at 8% and above? You mentioned we've been rising for the past week in a positivity rate, but do you know how many days we've been above that 8% moniker?
Well, we have the last date that they, repeat the question, and I apologize, I'm hard to train on this one. The question was, how long have we been above 8%?
As a region.
As a region. So we began to give you that notice, and I said normally we hear on Wednesdays as our day. We heard on Tuesday of last week, so we got a little heads up because there were concerns that those rates were rising quicker than they had anticipated. So we've been in at least 1 week. They will give us 2 weeks really to be able to drive down those numbers. And as I said, it's going to be a hard number to drive down when you're at 10%, and many of us in the county region, if you look on that page, it's all of our counties in the region, to drive that down. And the problem that we have is we do have infection spreading in the community. It's community spread. And so that's why we have to try and be super intentional about what we're doing right now. So that means trying not to do non-essential travel. I know we have a big weekend coming up. Some people got like a 4-day weekend in some of our areas. Is trying to stay close to home. Remembering staying within your family group. Order out, have a game night at your home. I know we're kind of tired and over this, but we've got to keep staying strong on this. Change it up a bit, figure out some other things that you might enjoy doing together. Take a walk. We've got beautiful parks. It's supposed to be a nice weekend. Do your activities out of doors as much as you can, because again, the more places that you congregate, as we've explained, the more chances that infection has to spread. It needs us.
You mentioned that this coming weekend is a potential, for some people, an expanded weekend. There is one thing at the end of this month that a lot of people are asking questions about, and that's kind of the Halloween season. Does Winnebago County going to release guidelines in the near future about trick-or-treating, haunted houses, along those lines?
So the question is about Halloween. The Illinois Department of Public Health, the Centers for Disease Control and Prevention, and the Winnebago County Health Department have issued, guidelines for Halloween and how to make it as safe as possible. Haunted houses are not permissible under any of the guidance. And the reason for that is that the intention is to have you scream. When you scream, you tend to expel droplets. There's also other activities that go on to touch and things like that to make you scared, which is all part of the fun of it. But during a pandemic, even with the likelihood of that transmission being untouched, the droplets become a very critical factor. And so those are not permissible. I'm going to call hay rides or pumpkin rides, depending upon which groups we have guidance on that so that you can go for a hay ride. You could do a haunted hay ride outside. You can ride with family members, but again, you're going to be wearing face coverings when you're seated on the wagon with family members who are not, or other people who are not part of your household. They're going to try and group people in households together. And again, to make this as fun as possible, trick-or-treating, again, we're really looking at the Halloween costume mask does not take the place of a facial covering. So the children that are going to be wearing costumes or adult costumes are all going to need to wear a face covering under that. We're going to have to really watch, because apparently as adults we're having the hardest time learning. Kids are doing really well in the school environment with their face coverings and doing what they need to do. I've seen some very creative, some of the hours with trick-or-treating will have very, extended hours so that different groups will be asked to trick-or-treat at various hours. We are asking that no one ever step within 6 feet, that households trick-or-treat together. If you're planning a trunk-or-treat type event, we've got some guidance out there as well, so that cars are spaced every other. And that if you're the one distributing goodies or treats, that they're individually wrapped, that you put them out on a table for the individuals to pick that up, that you hand sanitize in between. And of course, this is not new guidance from the time I was a child, that you have to wash your hands before you eat your candy. Because again, you've been out in the area and picking them up from all kinds of things. So that guidance hasn't changed. That's common sense ruling and guidance. We're going to try, and a couple of our, I'm going to say one of our schools has reached out. The high schoolers are planning a touchless Halloween event for their grammar school children. And they're developing some kind of tube system. This should be very interesting and very fun to see how they've done it. But our idea is, well, we can't return totally to normal. We've got to do some normalizing activities, but we've got to be mindful. So this is not Halloween on a weekend. For many people, that was another night to celebrate and go out, shoulder to shoulder, unmasked, have an adult fun time. This is going to be very different this year, and we need to understand why it's going to be different.
Just to confirm, Winnebago County's 7-day rolling positivity rate is 10.5%?
That's correct.
And do you know what the region is at right now?
I have that. 8.7, that was as of October 2nd.
And then our total cases is 6,685.
That is correct.
Okay.
The 4 businesses that were cited with non-compliance before this last weekend, are they all in submitted plans to get into compliance?
The question is, were the 4 that had previously been identified on our website as being issued notices, or have they submitted corrective action plans? 3 out of the 4 have.
And so what is the status then with that one, and then also, is that what we expect to happen with all of the businesses that you named today?
We have one that's a repeat, and I think all of you know that, repeat offender. They were on today's list as well as the previous list. They have indicated that they have no intention of coming into compliance. So we will move through that process with them. Am I thinking that all of them want to be in that scenario? I am hoping that they take a look at how their other businesses are being impacted, the other groups within their trade associations, and we don't really have a formalized trade association, but these are our neighbors. These are our families. These are businesses that are interdependent with each other. And, I can't imagine being established in them that's located next door to one that remained open and I closed because I was following the executive order.
Dr. Martel, what do you think of some of the statements that were made last week by some of our area elected officials about the new mitigation?
The question was, can I respond to some of the statements, or what did I think about some of the statements that were made by elected officials regarding the additional mitigation? I understand the frustration and, the concern. And I think that we had all hoped that we would be able to take a look at first tier 1, give ourselves a chance, an opportunity to drive those numbers down quicker. But it was probably becoming very evident based on the numbers that was not going to happen. And so I appreciate our elected officials advocating on behalf of our region. But I also want to make sure that we are clear about the role and responsibility we all have as leaders to help our community and our businesses do the best they can to come into compliance.
So I think you named off 30 establishments when I was trying to count with you that the Winnebago County Health Department received complaints on.
Mm-hmm.
And just to confirm that indoor dining, no masks, social distancing, what exactly falls into that now?
Okay, the question is, so of the establishments I named, what complaints were received on them?
Yes.
And the question was, it could be indoor dining, could be masking, could be no social distancing, or any combination of failure to comply with the executive order. And that's part of why, I've heard before, why don't we just immediately take action? Well, going out to find out what it is, right? We've talked about before, we need to understand if it's one, person wasn't masked, but they were not open and they were serving outdoors, and we go through the whole process and they have their records on file. Remember I talked, they have to have the reservations. If we find that they were doing all of that, then again, we take a look at was that complaint founded or unfounded.
why is it complaint driven?
The question is, why is it complaint driven? I think, first of all, Amy, the question is, as we worked through our food establishments from the beginning, we wanted to establish a basis of trust. And again, we do annual permit inspections as part of their permit. So we go out to make sure that they have all their policies and procedures in place, they're in compliance with public health. And at this time, as we move through, we have to go through a sense of trust, that we trusted our businesses would do the right thing, that they understood what they had to do to come into compliance. And so we committed at the beginning of being complaint driven, that we would go out and validate complaints, because there was also a fear and concern. We know about social media, someone giving a bad review intentionally, to an establishment, and we said we really cannot be part of that. We do not want to contribute to incorrect information or erroneous, information. That we would go out and validate it, review with them. Our goal was to provide additional education. If you remember when we first opened up in phase 4, it seems like a long time ago. Remember getting, personal protective equipment. Face masks were hard to come by. Getting all the gear that you needed. Getting your employees to return to work and make sure what procedures you were putting in place. So part of it was an opportunity for people to make the necessary changes. But when we have to step back and when there are new changes that have to take place, we go through the process with them. We have been working with them, sharing the information. That's why we meet weekly here, to go over our numbers. This should not be a surprise to our community that these numbers are rising, that we need to begin to take stronger actions to really protect our businesses, to protect our schools, to protect our lives and our livelihood.
Can you provide the list of the businesses, or will you add those onto the website?
The question is, will we add them to the website? And the answer is yes. We will be posting those that receive complaints on this executive order.
Will you be asking these businesses for the reservation lists so that you can ensure that those are being taken?
The question is, will we ask for that? And the answer is yes. They were sent out the executive order on Friday that was put out to all of them so that they were aware what other things would be required in terms of masking, in terms of the outdoor dining, in terms of capacity, and in terms of the reservation system.
What is your response to business owners who say that they don't want to comply with the all outdoor dining and they feel that they're kind of being unfairly hit and that they're taking all the precautions and they just feel like they feel like they're not contributing, I guess, to the spread of it, and they don't want to comply because they might lose their business?
The question is about business owners who feel that they have done what they need to do to reduce the spread and transmission. And unfortunately, I've told you what the common behavior is. And we're most likely, the common behavior of removing our face covering to eat and drink is done in a food establishment or bar or restaurant. And so that is in the nature of their business. And so while we cannot say that every outbreak or every case is associated with one of those establishments, it is a common general business that they provide. And we will work with them. As we've said before, we will do what we can to bring ourselves back out of this, and that's why the community needs to understand as well. So help them during this time frame. Patronize, become, order carry out. If you go in and want indoor seating, you're facing them into a situation that puts them in a very difficult bind about losing you as a customer and protecting their business. Don't make them choose. Do the right thing, get curbside, say, I'll sit outside, I'll take, I think we're pretty hardy people in this region. I know it's getting a little chillier, but it's going to get warmer at the end of the week. But do your curbside, do a pickup. We've got to protect our businesses as well.
And when did you say the county or the region will be reevaluated within a week for possible extra mitigation strategies?
The question was, how frequently are we evaluated? We're given 2 weeks.
2 weeks.
One incubation period.
I know some restaurants that were displeased with moving to outdoor, but if they're saying that if they can pitch a tent, have 2 walls down, and have heating units, is that really any better than they've been asking us? Is that really any better than having it just indoors, especially with no HVAC system?
The question is outdoor dining with tents with 2 sides up and a heater, it is been considered safer than the indoor. Because you begin to close down. Think about an indoor at this time of year. Most of it, there's very little outdoor at that point or fresh air exchange.
And, for the number of businesses that were not in compliance this weekend, was it 30, do you know?
I will have to count them
Okay.
down. We
Okay.
did not give them numbers, we alphabetized them.
No problem.
Could schools face additional mitigation measures after this 2-week evaluation period?
Well, okay, the question is, could schools face additional mitigation? Well, first of all, we look at schools from various, remember, we've got everything from pre-K to colleges and universities, right? So we look to see, and we've said before, what is the positivity rate within that environment or setting? Is there transmission going on? How many of the staff have been impacted, right? We've seen more spread in adults, but it could influence an impact. We know that I've heard from Rockford Public and I have a couple bus drivers, right? They drive their buses with the windows open, face shields down, with face coverings on to get the children to and from safely to school, with understanding that we may have to reduce some capacity if there are some after-school activities. If we're at 25 right now, I mean, most of them are in compliance with that to make sure that they're spreading children out as much as possible, but we may go into, really it's the after-hours types activities, like when you look at the all sports guidance, we're going to have to monitor and see whether those after-school activities are part of the problem as well, because I think we preserve in-person education as a priority for this community to the extent that we can, as long as it's safe to provide that within the boundaries of the school walls.
A lot of, another thing that restaurant owners have wanted to talk about is really they say that the positivity rate has spiked up, kind of it has coincided with the opening of schools. Can you kind of speak to that narrative? Is there any weight to that narrative?
So the question is, has the spike in positivity been linked to an opening of the schools? And to this date, we have not seen that linked. What we have seen is just a general opening, right? As we've gone out, we see a lot, and I've explained this before, we've seen no one particular event, venue, but we've seen a common behavior, which is removal of the face covering to eat or drink in a social type setting. So we have the after school activities. I call it the pizza party on a Friday night with the kids to come over and play games, right? In order to eat pizza, you got to take off your mask. And the next thing you know, 4 kids, maybe 1 out of 4. Adults the same way. They go out for a social event or a lunch together. And, again, when you have 1 out of 10 people in the community, we have community transmission. It wreaks very difficult. So we've seen the increase in community transmission started in about August, right before the schools. It's progressively, I said increased, but we are not seeing transmission within the school. These are outside the school walls.
I think you just said it there, but there's still not been any transmission within the schools.
To date, we have not seen transmission within the schools, but with a 10% positivity rate, we are continuing to monitor that very carefully. But there's a high level of quarantine going on in schools that's very different than the public. So, for instance, when we quarantine a classroom and we're following up with them, that group stays locked down for 2 weeks. Adults, much more difficult to keep them quarantined for 2 weeks. And that's really what we see, is that people end up having visitors from out of town. They may go and do something. And we do mostly voluntary quarantine, meaning we rely on people to do it voluntarily rather than issuing orders. And when they can't comply, then we issue an order. So schools do a lot of protective, quarantining in order to make sure that really everyone in the school environment, teachers, staff, and students are protected.
How many larger scale quarantines associated with schools are going on right now?
So the question is, how many larger scale, and what would you define as larger scale?
Like a classroom?
Oh, we have multiple classrooms. And there are reasons, we talked about the school metrics, right? When do we go to the adaptive pause or I'll return to remote? So for instance, I've gone over this a couple of times. Well, you know, again, it's important for everyone to really understand this. So in a classroom setting, if we have, let's say, one person in that classroom setting is a case, it depends upon what grade level they're in. So if they're in a pre-K, kindergarten, early elementary, where there's much more hands-on instruction going on with the students, as you would expect, there's much more of quarantining of a whole classroom for that protection. When you get into the upper grades, we really look to see from the seating charts and the teachers and the nurses who have to measure how far the desks are apart. We might see that the student in front of me, if I'm the case, and to the sides of me and to the back of me, if I'm one of those back talkers, you know, are quarantined. So that grouping of 5 may be quarantined. But if the teacher is more than 6 feet away in doing instruction, or I'm in the back row, that number changes. And so it depends upon the classroom setting and environment.
Where did the complaints go? What's the?
We, of course, our COVID hotline, we also get them from the governor's office, so people that call down to Springfield. The question is, how do we get complaints? I apologize. First of all, we have the COVID hotline, we have the COVID email. They call in, they send emails. We document the complaint, we log all of those so that they're assigned. In addition, if they call Springfield or the governor's office or a local elected official's office, those get compiled. And then again, you know, we may have multiple on one location or just one on a location, but we go out to validate those complaints.
Okay.
Anything else? Well, thank you for helping us to get the word out. Have a great afternoon, and everyone, please do what you can to protect our lives and our livelihood. Thank you.
See, before you have, do you mind if I see that list of businesses quick? I did not write them all down. I was not fast enough to write them all.
Well, you know,